Are there schools that teach healthcare innovation? When we started this effort 2 years ago, maybe there was one or two. Certainly we did it at the Harvard Business School, and maybe there were one or two others. We now have, 2 years later, more than 11 schools that either have degree programs in healthcare innovation or teach very intensive, effective classes in this subject.
My name is Finn Valentin. I'm a professor at Copenhagen Business School. Thank you for this opportunity to share with you some information on the new 2 years full-time Master of Science in Healthcare Innovation offered from the fall of 2016 onwards, jointly by Copenhagen Business School and the Faculty of Health at the University of Copenhagen. Combined, these two universities have an enrollment of more than 60,000 students. Although Denmark has one of the world's best healthcare systems, it is faced with major challenges, such as that coming from an aging population or from lifestyle-related diseases. A wave of innovations is needed to meet those challenges. In turn, that will require a new breed of healthcare innovators. The new Copenhagen MSc is designed to provide exactly those skills, and that requires faculty coming from both health and business disciplines, which is why the two universities are both involved in the new degree. Denmark has highly competitive industries in pharmaceuticals, devices, instruments, and health IT. Along with the major organizations in healthcare and in government, they take a strong interest in our new master's program in healthcare innovation, and they will be active partners in all aspects of the program. With this new degree, Copenhagen Business School and the University of Copenhagen take a step further in making the two universities an integral part of the coming wave of healthcare innovations.
This is an exciting time to be teaching the next generation of managers for the healthcare sector. Healthcare systems across the globe are seeking to achieve value for money, and they understand that an innovation focus is key to being able to do that. At ASU, we've recognized that innovation and innovation management is key to being able to achieve these goals, and we've organized our curriculum for graduate students to be able to learn all the aspects of innovation, including the business aspects, the nursing aspects, as well as the engineering aspects. Our new course, Approaches to Innovating in Healthcare Technology, brings together students from the W.P. Carey School, the College of Nursing and Innovation, and the Engineering School to innovate and engineer and design and bring to market those new products. While the technology has developed very quickly, the business models really have developed at a much shorter pace. And what we hope to be able to do in this course is to be able to get students to understand all of the models to be able to understand those goals. In the course, we're going to expose students to FDA issues, to issues related to venture capital, issues related to technology management, and be able to bring into our classroom companies, including group purchasing organizations, distributors, suppliers, and integrated delivery networks to be able to work together with our students so when they leave, they can enter the marketplace to bring immediate value to their companies.
So I'm Margot Seltzer. I'm a professor of computer science at Harvard School of Engineering and Applied Sciences. Recently, we've seen a real uptick in both the number and the fervor in the student community toward entrepreneurship. We see this from incoming students even before they get here, through our undergraduates and through our graduate students. We see this through increased enrollment in our entrepreneurship competitions, our business plan competitions, and in particular in students who see courses at the business school and are interested in cross-registering. So for the past 3 years, Reggie and I have been actively engaged in helping bridge the gap between the Harvard Business School students and the students in the School of Engineering and Applied Sciences, in particular in this domain of innovating in healthcare. Sometimes people ask, why do students come to Harvard who want to do technology? And I think this is a great example of why students come to Harvard to do technology. And it's because they have the possibility of using their deep technical expertise to really have an impact in fields like medicine, like healthcare. Innovating in healthcare really plays to the strengths of many of the technical students at Harvard because they've come here in order to have an impact and to change the world with what they learn about technology. One of the things I found most exciting working with Professor Herzlinger is that the framework we use to teach people how to innovate in healthcare is actually an instance of a more general framework about how to think about innovating. And because of the interest we see in the students about entrepreneurship, I think this is going to have broad implications. So the way we think about the framework is that there are two components. There's a business model, so how do you actually make money in a particular field? And then there are the exogenous forces that any business is going to have to deal with. So within healthcare, there's a huge regulatory component. In any business, there's a huge financial component. But no matter where you're trying to innovate, these two dimensions come together, and you've got to think about how to position a business so that you have a business model and you're likely to succeed given the forces around you in which you have to operate.
We also have created a MOOC, a massively open online course, to help disseminate the curriculum that we've developed in innovating in healthcare. Massively? We had 20,000 students, yeah, massively. If you'd like to look at this MOOC, you can access it at this website.
In looking at healthcare innovation, our idea is to look at existing business models and core basic constructs about how to run a business and how to manage a business more efficiently and more effectively, but then take off our organizational boundaries, rethink the organizational architecture and the business architecture of healthcare so that we can drive to actually new solutions, more innovative solutions that might use technology to substitute for labor, that might use labor to substitute for technology, and use both of them to substitute for capital and infrastructure investments.